Right now, millions of older adults are taking medications that are supposed to protect their hearts, but may be quietly damaging something just as vital: their kidneys. And the most disturbing part is this: these are not rare drugs or experimental treatments. These are some of the most commonly prescribed blood pressure medications in the world. Drugs that doctors prescribe every single day. Drugs that many people have been taking for years without ever being warned about the long-term consequences. Nephrologists and cardiologists are now raising serious concerns. In hospitals and kidney clinics, specialists are noticing a troubling pattern. Patients whose kidneys should still be functioning reasonably well for their age are showing accelerated decline. Filtration rates are dropping faster than expected. Creatinine levels are rising. Protein is leaking into the urine. And when doctors trace back the medical histories, the same medications keep appearing again and again. Large studies from institutions like the Mayo Clinic, Johns Hopkins, and the National Kidney Foundation are now confirming what many kidney specialists have suspected for years. Certain blood pressure drugs, especially when used long-term in older adults, are strongly associated with progressive kidney damage. This isn't about rare side effects. We are talking about measurable declines in kidney function affecting a significant percentage of users, in some cases increasing the risk of chronic kidney disease by more than 30%. The most alarming part is that kidney damage often happens silently. There is no pain, no obvious warning signs. By the time symptoms appear, the damage is often advanced and irreversible. But there is one blood pressure drug pattern that concerns kidney specialists more than any other, and we'll get to that shortly. First, it's important to understand how several common medications slowly strain aging kidneys. Diuretics, often called water pills, are frequently prescribed to lower blood pressure by removing excess fluid from the body. In older adults, long-term use can quietly reduce blood flow to the kidneys themselves. Repeated dehydration, electrolyte imbalances, and episodes of low blood pressure place chronic stress on kidney tissue, accelerating age-related decline. Beta blockers, which slow the heart rate and reduce cardiac output, can further reduce kidney perfusion in seniors whose circulation is already less adaptable. Over time, this reduced blood flow deprives kidney cells of oxygen and nutrients, increasing vulnerability to injury. ACE inhibitors and ARBs are often described as kidney protective, and in some patients they are. But in older adults with reduced kidney reserve, narrowed renal arteries, or inconsistent hydration, these drugs can trigger sudden drops in kidney function. Even brief illnesses or mild dehydration can tip the balance and cause acute kidney injury. Calcium channel blockers are generally considered safer, but long-term use has been associated with subtle filtration changes and protein leakage that often go unnoticed without regular testing. The risk increases significantly when multiple blood pressure medications are combined. Many older adults take 2 or 3 drugs at the same time, each altering kidney blood flow in different ways. Together, these competing effects can overwhelm aging kidneys. And now, we come to the pattern kidney specialists worry about most: the long-term combination of high-dose diuretics with ACE inhibitors or ARBs. This pairing is extremely common and often prescribed with good intentions, but in older adults, it can dramatically reduce kidney filtration pressure. Large studies have shown that seniors on this combination experience some of the fastest rates of kidney decline seen in outpatient care, often without symptoms, until damage is severe. The good news is that this damage is not inevitable. Regular blood tests, dose adjustments, proper hydration, and periodic medication reviews can dramatically reduce risk. Newer approaches to blood pressure management focus on individualized targets rather than aggressive lowering at all costs. Doctors are not telling patients to stop their medications on their own. What they are urging is awareness and conversation. Many people are taking drugs that made sense years ago, but may no longer be the safest option today. The kidneys don't complain loudly when they are under stress. They fail quietly, and by the time warning signs appear, it is often too late to reverse the damage. Awareness is what prevents that. One of the most troubling aspects of medication-related kidney damage is how rarely is discussed during routine appointments. Many older adults have their blood pressure checked at every visit, yet kidney function is often treated as an afterthought. A quick glance at a lab report, a vague reassurance that everything looks fine, and the prescription is renewed for another year. But kidney decline does not happen all at once. It happens slowly, quietly, over months and years. A small drop in filtration this year, another small drop the next. Each change seems insignificant on its own, but together they add up to a level of damage that cannot be undone. Nephrologists often describe the kidneys as organs with very little reserve in older age. By the time someone is in their 60s or 70s, they may already have lost a significant portion of kidney function simply due to aging. When medications further reduce blood flow or alter filtration pressure, there is very little buffer left. This is why a drug that is well tolerated at age 50 can become dangerous at age 70, even at the same dose. Another issue is how kidney injury is triggered during common everyday events. A stomach bug that causes vomiting or diarrhea, a heat wave that leads to mild dehydration, a short course of anti-inflammatory pain medication taken for back pain. In younger people, the kidneys usually recover without issue. In older adults taking blood pressure medications that affect kidney circulation, these seemingly minor stressors can push the kidneys past a tipping point. Acute kidney injury occurs, sometimes without obvious symptoms, and even if blood tests later improve, the kidneys often never fully return to their previous baseline. Each episode leaves behind a little more scarring. Over time, this scarring accumulates and progresses toward chronic kidney disease. What makes this especially dangerous is that chronic kidney disease dramatically increases the risk of heart attack, stroke, anemia, bone loss, cognitive decline, and hospitalization. The heart and kidneys are deeply connected. When kidney function declines, blood pressure becomes harder to control. Fluid balance is disrupted. Inflammation increases throughout the body. This creates a vicious cycle where medications intended to protect the heart may end up accelerating damage to both organs. Some patients are told their declining kidney numbers are simply normal aging, when in reality medication effects are playing a significant role. This does not mean blood pressure should be ignored or left untreated. High blood pressure itself is one of the leading causes of kidney failure. The issue is how aggressively it is treated and with which drugs. Recent research suggests that overly tight blood pressure targets in frail older adults may do more harm than good. Very low blood pressure can starve the kidneys of blood, especially when standing, during sleep, or during illness. Symptoms like dizziness, fatigue, and weakness are often dismissed as normal aging, when they may actually be signs of reduced kidney and brain perfusion. There is also a growing recognition that one-size-fits-all treatment no longer works for aging bodies. Factors like hydration habits, body size, muscle mass, other medications, and even diet all influence how blood pressure drugs affect the kidneys. Two people on the same medication and dose can have completely different outcomes. This is why many kidney specialists now recommend periodic medication de-escalation trials, where doses are carefully reduced under supervision to see if kidney function stabilizes or improves without compromising cardiovascular safety. In some cases, kidney numbers actually get better when medication burden is reduced. Lifestyle measures play a far larger role than most people realize. Adequate hydration alone can significantly protect kidney function, yet many older adults intentionally drink less water to avoid nighttime bathroom trips. Low-salt diets, gentle physical activity, and maintaining muscle mass help stabilize blood pressure naturally, sometimes allowing for lower medication doses. These changes are not dramatic or trendy, but they are powerful when applied consistently. The most important takeaway is not fear, but empowerment. Medications are tools, not permanent commitments carved in stone. As the body changes with each, treatment plans should change too. Asking questions is not being difficult. Requesting regular kidney function monitoring is not overreacting. Discussing whether current medications are still the best option is a sign of responsible self-care, not distrust. Kidney damage does not announce itself loudly. It whispers, and often, no one is listening until the whisper becomes a crisis. That is why conversations like this matter, because once kidney function is lost, it rarely comes back. But when risks are identified early, decline can often be slowed or even prevented. There is also an emotional side to this issue that rarely gets acknowledged. Many older adults develop a deep sense of loyalty to the medications they have been taking for years. Those pills represent stability, safety, and trust in their doctors. The idea that something familiar could now be harmful feels unsettling, even threatening. As a result, people often ignore subtle warning signs or hesitate to speak up when something feels off. They don't want to seem ungrateful, difficult, or distrustful. But medicine is not static. What was considered best practice 10 or 15 years ago is not always the safest choice today, especially as the body ages and research evolves. Another hidden risk comes from how fragmented healthcare has become. One doctor prescribes a blood pressure medication, another adds a diuretic, a third prescribes pain medication or acid reflux treatment. Each provider may be acting appropriately within their specialty, yet no one is looking at the full picture. The kidneys are the organs that ultimately have to process and balance all of these drugs together. Without regular comprehensive reviews, harmful combinations can persist for years. This is why nephrologists emphasize the importance of medication reconciliation at every major health visit, especially after hospitalizations. Even short hospital stays can result in new prescriptions that quietly alter kidney risk long after discharge. Older adults are also more sensitive to dosing errors. Standard doses are often based on studies conducted in younger, healthier populations. Reduced muscle mass, slower metabolism, and changes in body water all affect how drugs circulate and are cleared. A dose that seems modest on paper may be excessive for an aging kidney. Unfortunately, kidney function is frequently estimated using formulas that can overestimate true filtration in people with low muscle mass, giving a false sense of safety. This means damage may already be occurring even when lab values appear borderline normal. Education is one of the most powerful protective tools available. Understanding which medications affect kidney blood flow, which increase dehydration risk, and which interact dangerously during illness can help people act quickly when something changes. For example, many kidney specialists now recommend temporary medication pauses during acute illnesses like vomiting, diarrhea, or fever. This approach, sometimes called sick day rules, can prevent acute kidney injury by reducing strain when the body is already under stress. Yet many patients are never told about this simple strategy. The role of caregivers cannot be overstated. Family members often notice changes before lab tests do: increased fatigue, confusion, reduced appetite, swelling in the legs or ankles, and changes in urination are all potential signs of kidney stress. These symptoms are often subtle and easily attributed to aging, but when they appear after medication changes, they deserve attention. Encouraging open dialogue between patients, caregivers, and healthcare providers can catch problems earlier than blood tests alone. It is also important to recognize that kidney health is deeply tied to dignity and independence. Declining kidney function increases the likelihood of hospitalization, medication complexity, and eventually dialysis for some individuals. Preventing or slowing this decline helps preserve quality of life, mobility, and autonomy. This is not about avoiding medication at all costs. It is about using medication wisely, thoughtfully, and in alignment with the realities of an aging body. As research continues to evolve, more personalized approaches are becoming possible. Some patients benefit from lower doses, others from fewer medications, some from different drug classes altogether. The best outcomes happen when treatment is treated as a living plan rather than a fixed Prescription: the kidneys are resilient, but they are not invincible. They respond to care, to balance, and to respect. As this conversation continues, it becomes clear that protecting kidney health is not about one dramatic decision, but about many small, thoughtful adjustments made over time. One of the most overlooked factors is how rarely medication plans are revisited once blood pressure numbers look controlled. Control on a chart does not always equal health inside the body. For many older adults, blood pressure readings taken in a clinic do not reflect what happens at home during sleep. Or when standing up, nighttime blood pressure can drop too low, especially in those taking multiple medications, silently reducing kidney perfusion for hours at a time. Orthostatic drops, when blood pressure falls upon standing, are another common but under-recognized threat. Each of these episodes deprives the kidneys of oxygen-rich blood, and repeated exposure slowly weakens their ability to recover. Another important issue is the role of routine testing. Kidney function is not a single number. It is a trend. A slow downward slope over years is far more meaningful than whether a value falls just inside or outside a reference range. Yet many patients are never shown their trends or taught what those numbers mean. Without context, a gradual decline feels abstract and easy to dismiss. When patients are engaged and understand their own data, they are far more likely to recognize when something changes and advocate for adjustments before damage becomes permanent. Diet also plays a subtle and a powerful role. Excessive sodium intake forces blood pressure medications to work harder, often leading to higher doses than would otherwise be needed. High-protein diets, especially when combined with dehydration, increase filtration pressure inside the kidneys. Ultra-processed foods contribute to inflammation and fluid imbalance. None of these factors cause kidney failure on their own, but when layered on top of medication stress, they can accelerate decline. Small dietary shifts, made consistently, can reduce medication requirements and ease the burden on aging kidneys. It is also important to address fear. Some older adults worry that questioning medication will lead to judgment or abandonment by their healthcare providers. In reality, most clinicians welcome informed discussion. Medicine works best as a partnership. When patients share concerns, symptoms, or new information, it allows providers to tailor care more precisely. Silence, on the other hand, allows problems to grow unnoticed. The goal is not confrontation, but collaboration. There is a growing movement in medicine toward prescribing, the careful and intentional reduction of medications that may no longer be necessary or beneficial. This does not mean stopping everything. It means asking whether each drug still serves a clear purpose at its current dose. For many older adults, removing just one unnecessary medication can stabilize kidney function, improve energy, reduce dizziness, and lower full risk. These benefits ripple outward, improving overall health and confidence. Perhaps the most important message is that kidney decline is not an inevitable part of aging. While some loss of function is common, rapid or severe decline is often preventable. Awareness changes outcomes. Conversations change trajectories. When older adults understand the quiet ways medications affect their kidneys, they gain the power to protect themselves long before a crisis occurs. There is also value in understanding how early action can completely change the long-term outcome. Many kidney specialists emphasize that the most dangerous stage of kidney decline is not advanced disease, but the early phase when damage is still reversible or at least slowable. This is the window where small adjustments make the biggest difference. A slight reduction in medication dose, switching to a gentler drug class, spacing doses differently throughout the day, improving hydration habits. These are not dramatic interventions, but they can stabilize kidney function for years when applied at the right time. Unfortunately, this window is often missed because everything appears good enough on the surface. Another overlooked factor is how aging changes thirst perception. Older adults often do not feel thirsty until they are already mildly dehydrated. Blood pressure medications that increase fluid loss can worsen this without obvious warning signs. Chronic low-level dehydration concentrates the blood, increases strain on the kidneys, and exaggerates the effects of medications that alter filtration pressure. Over time, this combination quietly accelerates damage. Simple habits like regular water intake earlier in the day, monitoring urine color, and adjusting fluid intake during hot weather can meaningfully protect kidney health without affecting blood pressure control. Stress and sleep also play a role that is rarely discussed in kidney conversations. Poor sleep quality increases stress hormones that constrict blood vessels and reduce kidney blood flow. Certain blood pressure medications taken too late in the evening may further lower nighttime pressure beyond what the kidneys can tolerate. Adjusting timing alone can sometimes improve kidney markers without changing the medication itself. This is why individualized care matters so much in older adults. The body no longer responds in predictable ways. It is also important to acknowledge that many people feel overwhelmed by medical information. Long lists of medications, lab values, and appointments can make it tempting to disengage and simply trust that someone else is keeping track. But no one lives inside your body except you. Paying attention to how you feel after medication changes, during illnesses, or after missed doses provides valuable information that no test can fully capture. Fatigue, lightheadedness, swelling, or changes in appetite are signals worth reporting, even if they seem minor. For caregivers, advocating gently but consistently can be life-changing. Asking for medication reviews, requesting kidney trend explanations, and ensuring follow-up after hospital stays all reduce risk. Many episodes of kidney injury occur shortly after discharge, when new medications are added and the body is still recovering. This transition period deserves extra caution, yet it is often rushed. Slowing it down can prevent long-term consequences. As research continues to evolve, one message is becoming increasingly clear. Longevity is not just about controlling numbers on a chart. It is about preserving organ function, independence, and quality of life. The kidneys play a central role in all of this. They regulate blood pressure, filter toxins, balance minerals, and support nearly every system in the body. When they suffer, everything else feels the impact. This is why kidney health deserves the same attention as heart health in older adults. They are partners, not separate systems. Protecting one helps protect the other. The more informed the patient, the better that partnership works. Awareness does not create fear, it creates choice. Another crucial factor to consider is the cumulative effect of multiple medications taken together, often referred to as polypharmacy. Many older adults are prescribed several drugs simultaneously, each addressing a different health concern. While individually these medications may be safe, their combined effects can place a hidden burden on the kidneys. Interactions can amplify toxicity, alter drug clearance, or unintentionally lower blood pressure too much, all of which increase kidney stress. Doctors and pharmacists increasingly stress the importance of a regular medication audit, reviewing every prescription, over-the-counter supplement, and even herbal remedy for potential conflicts. This is especially important after hospitalizations, when new prescriptions are often added in quick succession. Dietary habits can also interact with medications to influence kidney health. High-sodium diets, common in processed and restaurant foods, can exacerbate blood pressure spikes caused by certain drugs. Similarly, excessive protein intake may increase kidney workload if the organs are already compromised. On the flip side, diets rich in fruits, vegetables, and adequate hydration can support kidney function and buffer some of the negative effects of medications. Nutrition, timing, and portion size are subtle but powerful tools in maintaining kidney resilience. Physical activity, often overlooked in older adults with chronic conditions, is another protective factor. Gentle movement increases blood flow to the kidneys, helps regulate blood pressure, and reduces inflammation. Even short daily walks or low-impact exercises like swimming or yoga can contribute to long-term kidney preservation. When combined with mindful medication management, Lifestyle adjustments create a synergistic effect that far exceeds the benefit of either approach alone. Mental health and stress management also indirectly impact kidney function. Chronic stress elevates cortisol levels, constricts blood vessels, and can exacerbate medication side effects. Practices such as meditation, deep breathing exercises, or guided relaxation may seem minor, but contribute meaningfully to maintaining stable blood pressure and kidney perfusion. Recognizing the mind-body connection in older adults emphasizes that kidney protection is not only a medical issue, but also a holistic one. Technology now plays a supportive role in safeguarding kidney health. Home blood pressure monitors, medication reminders, and digital apps that track lab results allow patients and caregivers to catch subtle changes early. Early detection of small shifts in kidney markers or blood pressure trends enables timely intervention before irreversible damage occurs. Staying engaged with these tools transforms passive observation into active prevention. Finally, one of the most empowering steps is to cultivate open communication with your healthcare team. Kidney issues are rarely isolated, and effective care often requires collaboration between primary care physicians, nephrologists, pharmacists, and even dietitians. Patients who ask informed questions, request alternative options, and track their own symptoms often achieve better outcomes. By taking charge of your medications, lifestyle, and conversations with your doctors, you can protect your kidneys and safeguard your health for years to come.